So here we are once again looking at a lot of the heuristics or the simple concepts with respect to working in osteopathic manual therapy. The thing that I want to look at here is the shoulder girdle generally, but especially the soft tissue. So I've talked about this before and I've showed some methods before. So the concepts that we're using are relational motion, one thing stays still, one thing moves in relation to it, as well as working on soft tissue perpendicular to fiber direction. So I'm going to show you something that I've done before, and this is a patient in supine. I'm going to try to show this in multiple positions so that you get the concept. So one of the things that you would have seen me do before with respect to the pectoral muscles, so we're going to have essentially a still pectoral muscle and a moving humerus and scapula, and we're going to work perpendicular to fiber direction. So relatively speaking, the fiber direction is this way. So I can move into the pectoral tissue this way. I tend to keep my thumb in what many would describe as a monkey grip or a thumbs out grip. I don't pinch particularly. I tend to leave the thumb up and bring it in close to the hand. And there you go. So I'm pushing on the soft tissue, on the pectoral tissue, and I have a relatively still pectoral tissue and a moving, right? It may not be the easiest to see because it's over my shoulder, but a moving humerus, right? So that's essentially what we're talking about. When we work on the, essentially call it the rotator cuff tissue, what's going to happen is I'm going to go perpendicular to the fiber direction to some degree, and then I'm going to have a relatively still tissue and moving humerus, right? So what it would look like is, in this case, this hand's going to go in like this, it's going to move up and down. The thumb is going to be across a lot of that tissue, whereas the grip, a lot of the grip on the back of the tissue is going to be in these two fingers. So it ends up, you can see my thumb come through, it ends up looking like this. A push and a pull, and I identify, now it's a still tissue, moving, in this case moving humerus. All right, so the thing that we're going to do to change that with respect to the pectoral tissue, because you can get this push, but sometimes it won't work. Sometimes you need to be perpendicular to the fibers, but also have some anterior to posterior component. So what ends up happening is now I actually do come around it, right? So here, I'll push up, pull down, right? So nice and free, resistance here. Now the other thing that I'm going to do that's going to be tough to show is I'm going to place his humerus against me so that I can manipulate the humerus or into positions with respect to internal external rotation that allow me to work there. So I'm usually going to be close. I can rest his humerus against my forearm and his forearm against my forearm and get some of this. But what I'm looking, and this is when we talk about the barrier concept, if we're going to go direct, so if this is the movement that has restriction in it, I want this movement to be created, but I need to think about a few things. Which tissue is still, which tissue is moving, and how to do that without the tissues themselves contracting in an active way. So I can add tension to them, but I don't want them to contract particularly hard. So I'm going to have to find, as I go into the sagittal plane, holding onto this tissue, it's still perpendicular to fiber direction, find the movement that allows me to do this. So in this case, if I do this, immediately tension comes into my hand. Now when I do this, you'll see how far it can go, right? You'll see how far it can go. But if I do this, I can go much farther with it, right? So I can get much more of the range. It is a still tissue or a still pectoral tissue moving humerus. Now with respect to the lateral side of the scapula, I can do the same here. Now I can also differentiate between essentially what you'd call the rotator cuff tissues and the tricep. So if I come here, lateral tissues of the rotator cuff-ish or lateral tissues of the scapula. If I come here, it's tricep. So what you'll notice is a wiggle there, less of a wiggle there, more of a wiggle there. That is the area that I'm looking for, the area that is not wiggling. Now if I go here, it's immediate tension. If I generate this internal rotation, I get more movement before I hit that tension. So it's a still tissue, doesn't necessarily matter which tissue, and moving humerus in that plane. Now my pre and my post, at least for this movement, are to essentially check whether or not the wiggle of the tissue when I pushed it and pulled it perpendicular to fiber direction ended up changing, right? So you could say that this is some of the teres, you could say that this is mostly lat. I'm not exceptionally concerned about which tissue it is. I'm much more concerned that I get change in it, right? So here, wiggle, 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 more of a wiggle. You agree with more of a wiggle?
More.
Right? Not perfect, but more, right? So you can alter the position of the humerus with respect to the scapula in order to expose the tissues in a variety of ways to work perpendicular to them. So I can work perpendicular this way, or I can add that AP component. And I can do the same thing with the scapula. So what I'm gonna do is, there's a pillow behind you, I'll grab it, and you're gonna end up laying facing the camera. Okay? So go ahead, you turn and lay facing the camera. Here's the pillow. Now, my head's cut off in the shot, but that's not the point. The point is to show you essentially the same thing. So if I want to work on the pectoral tissue here, most people would just do this, right? They'd grab, they'd go right there, and they'd do this. What I'm going to suggest to you is that you still have the same thing as in supine, but we're going to work much more appropriately with respect to how that tissue responds. So in a relative sense, it's a still tissue, moving humerus and scapula. I can do this, right? So that feels like it can go really far, nothing really bothers you, fair?
Yeah.
Yeah, there you go. Now if I go this way, similar thing, but it binds it up in a different way. There's way more tension, that you feel that more, fair?
Yes.
Right? So I have to be able to manipulate the humerus in relation to the scapula and to the still pectoral tissue to be able to move it the way that I would want. So that's one thing, right? So it's not just kind of grab it and rip on the arm, it's figure out what you need to do to that tissue. Still tissue, moving humerus in this case. Now, same thing, lateral tissues of the scapula. Right now, if you see his body wiggling, you would have a hard time believing that I'm testing the scapular tissues. Often, I need to stabilize with my torso, right, so that his torso doesn't roll around. So we find stuff in there, right? So if I go this way, it just immediately gets tight, so it gets tight, right? Now if I go this way, I can work it so it's still tissue. So I essentially have a pinch grip, right, on that tissue, relatively perpendicular to fiber direction. My forearm is on his ribs, but I'm not leaning into him. And I can really work that tissue, right? If I just do this in the direction that one would want to move it, it doesn't work. That is incorrect use of the barrier concept. If that tissue gets exceptionally tight, I'm not going to really get what I want because the body has to protect itself, and there's a variety of protective mechanisms to do that. Right now, the change in the tissue will not be as visible in this particular position, but that's okay. I'm not too worried. What I really want is for you to be able to see that there's a variety of ways to work it. So if I go here, too much tension. If I go here, it's fine. So this is that on and off rhythmic approach, things of that nature. But I just want you to be able to see that in multiple ways, we can use the same perpendicular to fiber direction, still muscle, moving bone. It shows up over and over again. So relational motion, contact is control. So if I'm checking in through here like this whole body's moving, this is incorrect. I would never believe you. I need you to get close, stabilize, check that tissue the best you can, and then get to work. And when you're working here, right, we don't want to do any of this. Right? People would say, oh, nobody does that. I promise you, if you watch videos, you will see many practitioners with a large amount of accessory movement that they're not aiming for because they're not using good contact. So contact as control is always there. Relational motion, still muscle, moving bone. And then working soft tissue perpendicular to fiber direction, these things are always there.